for joining me. My name is Adriana Rodriguez, and I'm a licensed marriage and family therapist here at EAS. Today's webinar topic is going to be anxiety disorders in children. Before we begin, I do want to encourage you to grab some paper and a pen and take some notes. I'm going to be giving a lot of additional information that is not on the slides. Let's begin. I'd like to just start with an overview of anxiety. So everyone experiences feelings of anxiety from time to time. These feelings can range from a mild sense of uneasiness to a full-blown panic attack or anywhere in between, depending on the person and the situation that's going on. It's natural for unfamiliar or challenging situations to prompt feelings of anxiety or nervousness for people of all ages. We might feel it if we have a big presentation at work or if life just gets overly hectic. Kids might feel it too. In similar situations, they might feel it when they're facing an important test or switching schools, and these experiences can trigger normal anxiety because they cause us to focus on the what ifs, what if I mess up, what if things don't go as planned. So some amount of anxiety is normal and can even be motivating. It helps us stay alert, focused, and ready to do our best. But anxiety that is too strong or happens a lot can become overwhelming. It can interfere with the ability to get things done, and in several cases it can start taking over the good and enjoyable parts of life. So what is the definition of anxiety? Anxiety is defined as persistent, irrational, and overwhelming worry, fear, and anxiety that interferes with daily activities. Anxiety disorders are the most common psychiatric disorder to show up during childhood. According to the Anxiety and Depression Association of America, which is the ADAA, it affects approximately 1 in 8 children. Children who suffer from anxiety are at a higher risk to perform poorly in school and miss out on important social experiences if they do not receive support. Oftentimes we get asked, how do we know this is not just a phase? What makes us so sure that this is an anxiety disorder? Well, the difference between a phase and an anxiety disorder is that a phase is temporary and usually harmless. Children who are suffering from an anxiety disorder experience the fear, the nervousness, shyness, and avoidance of places and activities that persist despite the help from their parents and caretakers. So an example, if a child sees a scary movie and at night they're having trouble falling asleep, that would be an example of a phase. Anxiety disorders tend to become chronic and interfere with how a child functions at home and school. So you'll be able to see that it's interfering with their functions in multiple places. Anxiety disorders do tend to run in families, but not everyone who has anxiety will pass it on to their children. Experts do believe that it's caused by a combination of biological and environmental factors. Stressful events can trigger the onset of anxiety, such as starting school, moving, losing a parent or a grandparent, but the stress itself does not cause anxiety. And it is helpful to be mindful that kids have a lot on their plates these days. Children today experience a lot more stress and anxiety than any previous generation. A lot of families are facing different challenges and stressors, environmental dangers, there's a lot of media exposure, a lot of stress related to the digital world and social media, peer relationships, and social pressures. And kids are especially vulnerable to these stressors since they have less control over their life. Okay, so next are some signs and symptoms associated with anxiety. So these are not the only signs and symptoms, these are just the most common. Younger kids often cannot articulate their feelings, so we often see physical symptoms present first. So they might have complaints of headaches, stomach aches, they might feel nauseous, they might report an increased heart rate, their heart's beating really fast, they might have diarrhea, constipation, they might feel restless, jumpy, on the lookout of something bad going to happen, they might have trouble with sleep. They might have complaints of frequent nightmares or waking often throughout the night. They might have repeated visits to their parents' room, trouble falling asleep. You might notice an increased vulnerability to them catching common colds and viruses. They might report tightness in their chest, neck, or back. Another big one we see is appetite changes, either low appetite or it could be the opposite. A lot of times we'll see fatigue and exhaustion, just low energy, not really sure why, even with the proper amount of rest. A lot of children report feeling sick in the mornings, especially before school. They might avoid going outside, playing with other kids, or just avoiding activities at school, like parties, camps, things like that. They might have an excessive need for reassurance. They might have trouble focusing and concentrating at school, being inattentive during class, and just notice a decrease in their school performance. Or it could be the complete opposite. You might see explosive outbursts, irritability, anger, something that they typically don't display, and all of a sudden you're noticing they're easily angered, they're triggered so quickly, and their reactions don't match the situation going on. And then they might have a loss of interest in normal activities that they typically engage in. So different symptoms are related to different disorders, which we'll take a look at on the next couple of slides. So what are some of the anxiety disorders in children? So I'm going to be going through the different anxiety disorders that we see in children. So the first one is generalized anxiety disorder. So if your child has generalized anxiety disorder, they may worry excessively about a variety of things. Some of the things could be family problems, relationships with peers, natural disasters, health, grades, performance in sports, punctuality, being on time. The typical physical symptoms that the children report having, they say they have headaches, their stomach hurts, especially on school days. They might be in the school nurse's office very often. They report feeling fatigue or inability to sleep. They might feel restless, difficulty concentrating, and irritability. Children with generalized anxiety disorder tend to be very hard on themselves, and they strive for perfection. These children may also seek constant approval and reassurance from others, even when they appear not to have any worries. There have been some parents of kids with generalized anxiety disorder that regret telling their children certain information, such as a neighbor possibly having cancer or a family member losing a job, because the children quickly turn it into days and weeks of distress about whether this might happen to them or what's going to be the outcome of the situation. In addition, these kids often think about things long after they've happened. So if they said something to a friend and they think they might have hurt their feelings, it will linger on for days and sometimes weeks. They worry a lot about whether they're good enough at school and sports and other activities. Even if they're performing well in school, they're just constantly worried about, what if I fail? What if I don't do well? Sometimes these kids are unwilling to try new activities unless they're sure that they'll be good enough, or they may quit a new activity if things aren't going well, even without giving themselves a chance to improve on or master whatever the situation may be. So most of the times it's really difficult to get them to even try something new. Okay, the next disorder is obsessive compulsive disorder, also known as OCD. So OCD is characterized by unwanted and intrusive thoughts, which are known as obsessions, and feeling compelled to repeatedly perform rituals and routines, known as compulsions, to try to ease the anxiety. So unlike everyday worries, obsessions are experienced as disturbing and bizarre. Some of the common obsessions that are reported is constant irrational worry about dirt, germs, or contamination. There could be excessive concern with order and arrangement or symmetry. There might be a fear of harm or danger to a loved one or self. There might be obsessions related to religious rules or rituals. There might be obsessions related to intrusive words or sounds, fear of losing something valuable, and also sometimes there's obsessions related to violent thoughts. And they might report having reoccurring thoughts of stabbing or hurting someone, and it's really distressing to them because they don't actually want to hurt them, but these thoughts won't leave their minds. So then the compulsions come to try to ward off the perceived risk or harm, and some of the common compulsions that we hear are washing and rewashing of hands to avoid exposure to germs, arranging or ordering objects in a very specific way, checking and rechecking objects, information, or situations, repeating a name or a phrase, an activity, or it can be a prayer, saving or hoarding items, counting objects such as steps, seeking reassurance, or doing things until they seem just right. So every time an unpleasant thought comes up, then they feel that need to do the compulsion, but over time the compulsions change and they become more time-consuming. So in the beginning it can start off as repeating a certain behavior or ritual, say 4 times, and then eventually it can turn into 16 or 30 times. So at that point, the solution perpetuates the problem. Okay, the next disorder is panic disorder. So first, I want to define what a panic attack is. A panic attack is a sudden rush of uncomfortable physical symptoms and a feeling of imminent danger, so doing something embarrassing, such as fainting or throwing up, or some people are feeling like they're having a heart attack or not being able to breathe. Unlike other anxiety subtypes, the first panic attack is not triggered by a specific event. It usually occurs out of the blue. Following this, children may fear and attempt to avoid the situation or setting where the first panic attack occurred in order to prevent it from happening again. So panic disorder, in order to be diagnosed with this, a child would have to experience at least 2 unexpected panic or anxiety attacks. So a panic attack usually includes at least 4 of the symptoms I'm going to list: feeling of an imminent danger or doom, the need to escape, rapid heartbeat, sweating, trembling, shortness of breath or a smothering feeling, feeling of choking, chest pain or discomfort, nausea or abdominal discomfort, dizziness, lightheadedness, a sense of things being unreal, fear of losing control or going crazy. There might even be a fear of dying, tingling sensations, chills, or hot flashes. So when a child is diagnosed with panic disorder, they've experienced 2 unexpected panic attacks, and then they begin to have a fear of having another attack. So then they start avoiding places and situations out of fear of having a panic attack and being somewhere and not able to escape from wherever they are. So then agoraphobia can develop, which is the extreme or irrational fear of crowded spaces or enclosed public places. It can develop when children begin to avoid situations and places in which they had a previous panic attack or fear that they might be unable to escape. So usually refusing to go to school is the most common manifestation of agoraphobia in kids. Okay, post-traumatic stress disorder, also known as PTSD. Children with post-traumatic stress disorder may have an intense fear and anxiety, become emotionally numb or easily irritable, avoid places, people, or activities after experiencing or witnessing a traumatic or life-threatening event. These events can include a serious accident, a violent assault, physical abuse, or a natural disaster. Children with PTSD often re-experience the trauma or event through nightmares and flashbacks. When that's happening, it's the brain trying to process and make sense of the situation, which was so overwhelming. They have difficulty sleeping, concentrating. They might also feel nervous about their surroundings, easily startled or jumpy around loud noises. They might withdraw from friends and family. Symptoms may not appear until several months or even years after the event. And not every child who experiences or witnesses a traumatic event will develop PTSD. It is normal to be fearful, sad, and apprehensive after such events, and many children will recover from these feelings in a short time. The children who are most at risk for PTSD are those who directly witnessed a traumatic event or who suffered directly, such as an injury or death of a loved one, or if they've had any prior mental health problems before the event, or if they don't have a strong support network. Violence at home also increases a child's risk of developing PTSD. Okay. The next disorder is separation anxiety disorder. So children with separation anxiety disorder suffer excessive distress in the face of actual or even imagining separating from their parents. It's typical for young children to go through some difficulty adjusting to separation, such as going to school, staying with a babysitter, Children with separation anxiety disorder do not make these adjustments. So most kids have that period where they feel sad, they cry, that's all normal. But if it's separation anxiety disorder, they don't make that adjustment. They continuously cry and have that big reaction to the separating. So some children may feel safe as long as they're home with mom or dad or any other caretakers. Others may be unable to tolerate any physical distance and will shadow their parents or caregivers around the house. They often find it hard to be on a different floor of the house of the parent if the parent's not there. Many children have trouble going to sleep on their own and may sleep in their parents' room or bed. They may have a lot of trouble at school, especially in the mornings, complaining of aches and pains they feel, or cry or get very angry. These children are often afraid to go play at other children's homes and don't attend sleepovers, field trips, or even drive in other people's cars. Many children experience separation anxiety between 18 months and 3 years old, when it's normal to feel some anxiety when a parent leaves the room or goes out of sight. Usually the kids can be distracted from these feelings, and it's also common for your child to cry, like I said earlier, when they're first being left at daycare or preschool. But eventually, usually the crying subsides after becoming engaged in the new environment. So if your child is slightly older and unable to leave you or another family member, or takes longer to calm down after you leave than other children, then the problem could be separation anxiety disorder. It's most common in kids ages 7 to 9, and when separation anxiety disorder occurs, the child experiences excessive anxiety away from home or when separated from their caregivers. They have extreme they're feeling really homesick, misery for not being with them. Okay, the next one is social anxiety disorder. Social anxiety disorder, or it's also known as social phobia, is characterized by an intense fear of social and performance situations and activities. This can significantly impair your child's school performance and attendance, as well as the ability to socialize with peers and develop and maintain relationships. So some of the symptoms can be that they might be hesitant or passive and discomfort in the spotlight, avoiding or refusing to initiate conversations or invite friends to get together, order food at restaurants, or call or text or email peers. Frequently, they will avoid eye contact with adults or peers. They speak very softly or mumbling. They appear isolated, even in a group. Sitting alone at school, such as in the library or cafeteria, or hanging back from a group in team meetings. They're overly concerned with negative evaluation, humiliation, or embarrassment, and they have difficulty with public speaking, reading aloud, and being called on in class. So children with social anxiety are not just a little shy, but rather they are painfully uncomfortable in any situation where they can be embarrassed or feel that they're being evaluated. They may see these threats even in safe situations. They just might feel threatened or uncomfortable that something's going to happen, they're going to be embarrassed, people are going to laugh at them, make fun of them. And these children often wish they had more friends, but then they find it hard to do the things that are required to make friends. And the children with social anxiety, they appear very uncomfortable and they may choose to withdraw in order to prevent any risk of embarrassment. They're very successful at being invisible, and they may be unnoticed by peers and have a socially neglected status because of their voluntary isolation. All right, selective mutism is characterized by children who refuse to speak in situations where talking is expected or necessary, to the extent that their refusal interferes with school and making friends. So while children develop selective mutism for a variety of reasons, in most children with the condition, it is thought to be a severe form of social anxiety. Children suffering from selective mutism may stand motionless, expressionless. They may turn their heads, chew or twirl in their hair, avoid eye contact, or withdraw into a corner to avoid talking. These children can be very talkative and display normal behaviors at home or any place where they feel comfortable. So a lot of times parents are very surprised to learn from a teacher that their child's refusing to speak at school. And the average age of the diagnosis is between 4 and 8 years old, or around the time that the child enters school. So when children experience extreme anxiety in social situations to the point of consistently refraining from speaking in public places like school, church, playground, he or she, they may be suffering from selective mutism. It can be very confusing for the adults around them. Kids have a very clear line of places that they can talk and they can't talk, and it's very puzzling for the adults that see them in a complete different way when they're at home or in their comfortable environment. And the last one is specific phobia. So specific phobia, instead of worrying about multiple things, phobias refer to a very strong fear of a particular thing, such as dogs, doctors, shots. Some kids can have multiple phobias. The child fears the situation and also either avoids the situation or experiences severe distress about the situation. Children might have a fear of bees and get so upset that they cannot play outside in their backyard. So that would be the avoidance. Or they might run into their house crying whenever they think they hear a bee, or they won't go swimming in the summer because of the fear. So also severe fears of weather, such as thunderstorms, costume characters, small animals, insects, water, the dark. Those are just other common childhood phobias. So although phobias are more contained, they can undermine a child's confidence greatly. When everyday activities such as going outside or even being in PE class are avoided because of the fear of, say, the bee, the kids will feel embarrassed that they're terrified in a commonplace situation that other kids are not. And unlike adults, children typically do not recognize that their fear is irrational. Okay, so treatment for anxiety. So the good news is that anxiety disorders in children are treatable. There are several scientifically proven and effective treatment options that are available for children with anxiety disorders. The two treatments that are most helpful for children to overcome anxiety is cognitive behavioral therapy and medication. So if you have any concerns, we do recommend that you first talk to your child's doctor, let them know what's going on, what are the symptoms you're seeing, the behaviors, and then see what they recommend from there. So the doctor might recommend one or a combination of treatments. No one treatment works best for every child. One child might respond better or sooner to a particular method than another child with the same symptoms. It really just depends. So that's why it's important to just discuss it with your doctor and then make contact with a therapist based on the recommendation. So cognitive behavioral therapy, or CBT, is a type of talk therapy that has been scientifically shown to be effective in treating anxiety disorders. In CBT, it teaches skills and techniques to the child that they can use to reduce their anxiety. So it focuses a lot on their thinking that's making them feel anxious, things that they can tell themselves, things like that. And then for the medications can be effective in treating anxiety disorders as well. Some people prefer to start with the therapy, and then if things aren't improving, then look at medication as an option, whatever you're most comfortable with. A lot of research does show that a combination of the CBT and the medication work better for children. So with having them both at the same time, medication can be short-term or long-term. It really just depends on the severity of the symptoms and how the child responds to the treatment. All right, so some self-help coping strategies, so some things that you guys can try on your own. So the first is progressive muscle relaxation. So it's a classic meditation that teaches you how to relax your muscles. It's especially helpful for the kids that are experiencing a lot of body aches and muscle tension. On the resource page, I did attach a link to a common video that kids can watch, and you can watch with them, and shows them how to practice this method. The next one is the deep breathing or belly breathing. It promotes relaxation, and so the proper way to practice the deep breathing is in through the nose and out through the mouth. There's also another video that I did attach to the resource page. It's the Sesame Street belly breathing, really popular with the kids, and again, it just teaches them how to practice that deep breathing when they're in those stressful times. Transitional objects. So these are really just known as special comforts, and they help children make that emotional transition from dependence to independence. They're especially helpful with children that have separation anxiety, so something that they can hold and take with them, especially if your child's having trouble getting to school or the trouble is being at school. You can try to work with their teachers to see, okay, is it okay if they bring a special object from home that they are really connected to and feel comfortable so that it can help them throughout the day? So typically it's thought of as like a blanket or a stuffed animal, but it doesn't have to be something like that. It can be anything. It can be a keychain. It could be something that they consider a good luck charm, whatever works for them. And it even can work with older kids, too, that have anxiety, just something that brings them comfort, nothing too big. And you can call it a comfort item, transitional object, whatever you prefer, but just something to give them that comfort throughout the day when they're having those feelings. Positive self-talk. So with anxiety, a lot of times people get stuck on the worst-case scenarios or thinking about the what-ifs, so positive self-talk can be very helpful. It's a form of distraction that does not have any negative consequences, and it's very beneficial because your mind tends to adapt to the words you say. The more that you say it, the more that you believe it. So one way that positive self-talk works is that you can use affirmations. You could just teach your child or adolescent to say things such as, I'm in control of my anxiety, over and over. They could say it in their head. They could say it out loud, whatever works for them. And other people also find it helpful to think about or talk about a positive experience during times that they're having a lot of anxiety. And calming visualization, it's a form of relaxation. It's meant to get the child to slow down and relax so they can visualize a relaxing image in their mind. That can be whatever is relaxing for them. Or you can watch a relaxing scene, a video, or a picture, whatever is going to be most helpful. Some strategies for parents and caregivers. So things can be stressful at home for everyone if there is a child at home that's experiencing a lot of anxiety, so it's helpful to build a supportive network with your friends and family. And some things just to keep in mind. The first is to stay calm. When your child becomes anxious about a situation or event, children often look to their parents to determine how to respond to situations, and children of all ages pick up on their parents' emotions and it resonates with them. So if you're anxious, your child will pick up on that anxiety. So if you want to reduce your child's anxiety, you must manage your own anxiety. So deliberately slowing down on your speech, taking a few deep breaths to relax, and working to ensure that your facial expressions convey that you are calm. So you're going to be the model for them and show them how to respond to different situations and events. The next is to recognize and praise small accomplishments. So you want to reward your child's brave behaviors. It can be with a small reward, a praise, or even a hug. Usually just a simple acknowledgement goes a long way, just acknowledging like, wow, you did that, you know. Normally if it's something that they're afraid of doing or brings them a lot of anxiety, just acknowledging like, wow, you were able to accomplish that. Allow your child to express their anxiety. You really do want to encourage your child to express their anxiety. So if your child says they're scared and then you say things such as, no, you're not, or you're fine, it might make your child believe that you don't understand them or you're not listening. So instead, you should try and ask what it is they're worried or scared about, and that will open up a conversation to talk about their fears and worries. You want to plan for transitions. This is especially helpful for those kids that are having difficulty with school in the morning. So you want to allow for extra time in the morning, and it'll just decrease stress for all involved. You'll be less frustrated if you plan ahead for that time. And lastly, you want to be flexible, but try and maintain a routine. So routines are important for kids of all ages, but it's also helpful to be flexible, especially if we have these different symptoms and behaviors going on. So you just want to modify your expectations during these stressful periods. And I do want to add, just to keep in mind that your child's anxiety disorder is not a sign of poor parenting. Okay, these are resources. So worrywisekids.org has a lot of information on childhood anxiety. I attached 49 phrases to calm an anxious child. These are very helpful. This is a book, Helping Your Anxious Child, a step-by-step guide for parents, and these are the video links for the belly breathing and the progressive muscle relaxation. And then lastly, you can always contact us here at EAS for more support. So thank you so much for your time. I hope this information was helpful, and we will see you guys next time.